the show. I am Apurva Raghavendra. So let's start today's program. Today we have the person with the immense knowledge in the field of toxicology and forensic medicine, Dr. H.C. Govindaraju as our guest. So welcome to the show. Still we are going in the pandemic and there is an alert on third wave. What precautions should be taken to be safe?
Yeah, you are talking about corona, right?
Yes, sir.
See, when you say corona, now we are already having corona, which is called as a crown. We are already having the crown with the help of the corona warriors, like doctors, nurses, police officials, other people, BBMP workers and all. We have already chased the corona out of our country and out of our state. So that's why I feel that we are having a crown now about the corona. I don't think that now corona is existing at all. Even if it is there, it is only in the traces. That's it. So as far as this first wave, second wave, third wave you are mentioning about, no? First wave we already killed that. Second wave, it is one of the variant of the least resistance first wave corona virus. And the third wave is some people actually in the health field, government of India Health and Family Welfare, they say, by name Mr. Agarwal, spokesperson of the Health and Family Welfare, he said there is no third wave at all. People are, you should not get scared about third wave at all. It is only a variant of second wave. It is coming down, count down. So people should understand, they should not get scared about this COVID anymore. That's what I feel.
Sir, how could you describe the role of health workers to create awareness among the people?
The health workers are doing their duty from the first time itself. When it started in 2020 January, even now they are actually advertising is going on, counseling is going on, health education is going on. I'm to some extent I'm quite happy with the present government who has formed that, our honorable chief minister S. Bommai, Sir Basuraj Bommai. See what he has done, some advertisement like this, video, audio advertisement.
Create awareness among people.
Definitely there is necessity is there, definitely, okay, with that intention only they are doing, okay. It has helped a lot, so like this we also have to create an awareness. All the public should join and then create an awareness.
It's true that third wave will affect younger generation and children's. So what are the scientific reason behind it?
Third wave affecting the younger generation, I'm not totally agreeing with that. Now first of all there is no third wave at all, as per Agarwal I told you, okay.
But
in case if it comes, we are ready. We have all the things ready. Everything we are ready. Vaccination ready, RT-PCR kits are ready, doctors are ready. We are ready to fight the war at any time. We need not bother about third wave or anything.
Sir, did you feel that we are getting actual COVID death rate in India?
That is a very tricky question, Amma. See what has happened is, so many deaths are occurring every day. It does happen that sometimes they may mix up the number of deaths due to other causes with the COVID also. In fact, our senior minister, former minister K.H. Patel, Congress minister and MLA, he raised that issue. It was in a Hindu article, okay. He said the number of deaths due to other causes, not due to COVID. And he has asked that proper medico-legal certification of death also, okay. So he has commented that also. So I also request the government to look into that, his point, the valuable point, okay. So one thing about the medico-legal certification of death, what he has asked, I appeal to the clinicians, the physicians who are dealing with that, to frame a proper cause of death certificate. Actually, we are the people, forensic people are the one who are involved in framing the death certificate. But sometimes physicians also have to do that in our absence. So there, what we do, for example, some take a COVID case only. Then see, in the COVID case, there are a lot of causes may be involved for the death. The pneumonia, lung infection, pneumonic consolidation, then brain is involved, septicemia, then heart is involved, then other organs are, it is like a multi-organ failure. What they are putting, I have seen with my own eyes, they put it as respiratory failure and then due to COVID. That is not the proper way of putting the death certificate, okay. So when it comes to, it is a separate platform, I will appeal to my professional colleagues also to use that WHO formed, they frame the death certificate. Now it comes in section 1 and section 2, number 1 and number 2. In number 1, what it says, A, B, C. See, the A, B and C are should be related to each other. One example, before coming to corona, I will tell you one more example, simple example I will take. I also dealt with traffic cases during corona period. That is, I dealt with corona cases, murder cases who have died as a result of corona. Okay, couple cases. This is as per the guidelines of the Health and Family Welfare Karnataka State Government and only target organ should be elected. Okay, I decided that organs are get only. I respected that order. Okay, in that what happened? In one case, there is a head injury, okay, due to traffic accident, and there is a fracture of the bones. Head injuries, brain injury, severe blood loss. So, in that case, as per the WHO, what we have to do? What is the immediate cause of death? Acute blood loss or hemorrhagic shock. How it came? Because of the fracture of the bones and then the head injury. Because in what way it is related to this one? B. Because of the traffic accident. That's how we have to frame that. Sometimes person will be having some other diseases, the diabetes, hypertension, something. You can put that in the second section, second A and B. So I will appeal to all the clinicians also to strictly adhere to this rules and regulations of certification cause of death, and which will go very well in accordance with what our minister has earlier former minister has raised that question, KH Patil.
Okay, sir. Now, India has taken intense rate of vaccination drive so far. How do you see the factor in rising down positivity rate?
Positivity rate is very good, actually. I may have to refer about this vaccination. I noted somewhere. See, because of this vaccination, so present rate is only 1.3% actually.
But
1.3%, that's all what we are having that corona. Okay, so I do have that, when we Google it, we get that the exact vaccination coverage details, totally till now actually, up to the 15th of this month, September, okay, about 1 crore 1 crore and 84 lakhs 4,112 have been vaccinated already. I'm talking about our state. So look at this only. It has come to 1.33% death rate. Earlier, discharge cases are 97.64% and active are only 1.03. Okay, so the death rate is a little bit more in actually Kerala. Actually, last year from August, from the 1st of January to June, it shows in death rate 69 in.
And you have travelled widely and internationally. If we were to compare the health system, what difference do you see here and there?
Nowadays, I don't see any difference. We are also equal to the Western standard. We got everything, all the experts. In fact, in abroad and all, in all the super specialty, most of them are Indian doctors only. I don't see much. Only thing is when you go to the emergency department, there they may take some more time, to attend a patient 2, 3 hours, 3 hours, 4 hours. Sometimes I have seen where I was working. Here they attend very quickly, because saving the life of the patient is very important in emergency situation. Okay. Next comes our other history, medical legal aspects. First, on the spot diagnosis, what you can do, looking at the signs and symptoms. Oh, this is a thing. Start the treatment. Okay. Later go for investigation. And there they don't go for unnecessary investigations actually. Here they go for unnecessary. I have seen my own relatives, my cousins, my friends' case and all those things. Chest pain, take ECG. Oh, okay, go for echo, go for CT, go for something else, MRI, all those things. So they have to cut down all these things. Strictly we need to advise the doctors, what is necessary, because that will cut down the cost of the treatment, put a lot of, it puts unnecessary burdens on the patient. Yeah, that's bad. What is necessary, you do that, that's it. Unnecessary, leave it.
Sir, you are a forensic medicine professor. What exactly is the forensic medicine?
Forensic medicine means, administration, application of medical knowledge to aid in the administration of justice. In Kannada we call it Vidhi Vaidya Shastra or Nyaya Vaidya Shastra. See, Nyaya Vaidya Shastra. we have to give justice. See, three persons, when you form a triangle, the doctor sits on the top, and the other side justice system, and the other side the police officials. Okay, so we all three join together. It's like that, you know. See, whatever we learnt in first year MBBS, anatomy, physiology, biochemistry, medicine, surgery, all these things we apply in forensic medicine. Okay, we help in the administration of justice. This is forensic medicine. Okay, of course, toxicology is a branch of forensic medicine. We deal with, you know, all kinds of, you know, snake bite, drugs, drug poisoning, all other kind of things, alcohol poisoning, those kind of things, all those things we do, and we do give the report. Okay, so one thing is that, you know, when I was in abroad, when I was in the witness box, the doctor used, the lawyers used to tease me. Okay, what is it? You are a dead man's doctor, dead man's doctor. Then I said once, see, I was really taken aback. Everybody is laughing, you know, coroner, judge, the audience, everybody, including the accused. Then I said, suddenly it's taken my mentor, Dr. V. Kandaswamy, who is there in the photo. He used to tell me that, you know, I remembered he's from Kerala, Medicolegal advisor to the government of Kerala. You see one more picture there, Dr. Shankar Pillai, there also, he is also my mentor, Medicolegal advisor to the government of Kerala. Very top position in the government of Kerala. Now I rate them as number one. So I used to remember them. See, we deal with both living and the dead. Whereas clinician, surgeon, they live only with the dead, living person. But I deal with, when I am dealing with a sexual offense case, examining the victim or the accused, I deal with a living person. When I am examining the drunken driving case, I examine the living person. But when it comes to the mortuary, I examine the dead person. So in the whole universe, I will say, I'll raise my collar and say, we are the only doctors who deal with both living and the dead.
Sir, what is the objective of South Indian Medicolegal Association? What role do you have in this?
It is shortly called as SIMLA, SIMLA, not that SIMLA, this will South India Medicolegal Association, wherein, you know, all the doctors, forensic experts from the South India, we join together once in a while, you know. We have conferences, one is, and yeah, once I was the organizing secretary in Chennai in 2012, you know, wherein I called all the different states from the police commissioners, lawyers, doctors, everybody for that conference, you know. We exchange of views, you know, in different states, what medical legal issues, and is there any sensational cases you came across, how you dealt with the other case, how you dealt with this important murder case, how you solved this one. Those things we exchange, you know, there is an exchange of knowledge. That is it. So I am the member of that. Okay, so I am the member of the Indian Society of Toxicology also, member of South India Medicolegal Society, and member of our Karnataka Medicolegal Society also.
Apart from your profession, you helped so many people as a social worker. How do you feel that work?
I really enjoyed, actually during that time, to be frank with you, the government order is there, doctors who are dealing with COVID cases had to be, no salary should be cut down. But in a hospital where in East Point, they cut down the salary, 50%, 50,000 I was getting, that used to go for my loan. But somehow I saved money, what earlier I saved money, I spent around 1 lakh, and with the help of our Shivu and other people, you know, I was able to organize, you know, he has already organized a couple ration kit. So that gave me courage and strength, and then he actually the initiative behind that Shivu. So yeah, like that, you know, people have to come forward to help the people who are in a really need, you know. So I do involve, you know, God's willing, if they get some more chances, you know. Okay, I don't want to see the corona anymore, but any other calamities comes up, you know, something like that, we are all, you know, joining together as a team. We should be able to help the community. That is my feeling. So in the name of my father, you know, actually my memory of my who very recently, so I organizing with the help of Shivu distribution of ration kit.
So now the students and young people are getting suicide. What was the reason behind this?
At this situation, you put a very good question. It is a very, very sensitive issue, suicide, you know. See, what happens in suicide, people, is a matter of a minute, okay? They take the decision to commit suicide, and within fraction of a second, they die. See, we have to educate the people, counsel the people, counsel everywhere. You can appoint the council, government can appoint the counsellors, you know, to counsel them, especially this, people who are prone for this kind of tragic deaths and all, you know. See, what happens when you hang, no, what happens in a fraction of a second, the ligature mark is here, and then little bit pressure on the carotid sinus, you go unconscious. And even if you want to release yourself, you want to save your life, you cannot. There is no chance. You are already gone into a stage of unconsciousness. Whereas we have seen some people, when they try to extricate themselves from the noose and they could not leave. So it is such a dangerous, I appeal to all the parents also to educate them properly. It is, if there is any problem, if they sit in the four chambers, brothers and sisters, counsel them, and so that we can control this. I have seen couple of cases, software engineers who committed suicide. That fellow Papa, he took the laptop, he went and sat in his friend's house, and with wife he cannot tell, no, I'm not getting the salary like that and all. Okay, they lead a good life earlier, and he went and sat there, giving the reason that I'm working from home only from my friend's house. He committed suicide. He lost the job. Another worker, a carpenter, who was not able to pay his the labor to the workers. Okay. Carpenters also that the major the owner, and then this fellow labor also he died. I've seen this. So government has to work out on this, especially during these type of situations. Some kind of helping nature, like this counseling, all those things. I think it needs a lot of attention. What I feel.
So now the schools were reopening, and parents were very much worried about their children. What's your opinion on it?
Let them open the schools, because I told you third wave is not at all there, it's not yet come. Okay, even if it comes, we are ready. There also schools also, their teachers and all very well educated, and they maintain the social distance. It brings down a lot of tension on the parents who are very well. Online coaching was going on for the past 2 years.
But parents and students were fed up with these online classes.
Yes, exactly. Online, what the children, what they will do, when they watching in front of sitting in front of laptop and all, child will ask, mommy give me milk, mommy give me that. She will go that side. At that time, mommy has to replace the child, and she has to note down the points. And again after the class, one more class from the parents, all those things. I have faced it. Medical students, I am telling you, I took the online classes during COVID class, okay. There all 20 plus students, okay. As soon as they start the class, they log in. Gradually, one by one will disappear. I don't see their faces on the screen at all. Gradually, and when I start taking the attendance, they will rejoin. Okay. So like that. So immediately I used to call them. Whoever disappears, immediately mark the absent. Again when they appear again from somewhere, and as per I was present, I know you are present now. I know you were present at the earlier, but in the middle you are not present. So you are absent. That's it.
Thank you, sir. That was an interesting and informative conversation, sir.
Thank you very much. I really appreciate your gracious gestures in coming all the way from your channel with your team. Okay, I really appreciate, and for bringing me to share some of my views to the citizens of our country and the state. I really appreciate.
It's our pleasure.
Okay, Jai Hind and Jai Karnataka.
Thank you.
Thank you.